Well, I was some 14 years ago now approached to apply for the job of Executive Director of Alzheimer Netherlands. I had a little bit of family history with dementia, but didn't know much about it. But I thought it was an opportunity to contribute to a huge societal problem. So I applied for the job and I took it. And after 7 years, I got again an opportunity to apply for the position at ADI. And when you're working in this field, you have to deal with a lot of different issues. It's the families who need support, but also the challenges in research, and that makes it worthwhile. Yes, we are the umbrella body, the federation of all the national Alzheimer societies. And we have at the moment 79 members, one per country. All the member associations are supporting the people with the disease and their families. So they have support groups, they have helplines, they organize meetings, but they also, some of them are funding research. And together we try to find solutions and exchange information. Our role is also to help emerging associations in countries around the world to grow and to develop their own association. And we do trainings for that, and we help them and support them as much as we can. Yes, of course, it's Alzheimer's and dementia is a growing problem worldwide. The numbers are going up because the world population is aging. And for example, we have a new case now every 4 seconds somewhere in the world. So it's an urgent problem, it's a complex problem, and we think that the best way to prepare is by creating these national plans so that governments can respond and make their health systems accessible for people with dementia and their families. Again, you can see from other disease areas like AIDS or diabetes that the national plan makes a difference. If a government is not convinced, then often our member organizations try to advocate for that, and we support them in advocacy. And that's also why we publish a World Alzheimer Report every year with data from research, from systematic reviews about the numbers of people with the disease, about the cost, about solutions. And this year we look at care, continuum of care. And that is a resource in the countries to help create policy over there. Well, there are a number of them. It's still related to stigma, which means that many people have a fear of the disease and don't know much about it and have troubles talking about it. So not enough people are seeking a diagnosis or are getting a diagnosis, for instance. That also means that they don't get treatment or support. So that's one of the barriers at the moment. The other one is, of course, that there is no cure, although there are some medications that slow the progression, but there's not much hope that we can give. However, on the other hand, there are many non-medical interventions that are effective, that have been proven to be effective, and it's good if people can use those. But they're not so well known, and as many people are not diagnosed, they don't have access to those treatments. Yeah, the research funding is far behind other disease areas, and that's a real pity, because we have seen in the cancer and HIV world that the huge research budget really has made a difference in the last 20-30 years. And we need a similar investment in Alzheimer's research as well. So that means that we need 5 to 10 times more money than we have now worldwide. Well, one of the findings from the study that we did is that there is no other disease area that is linked to so much need for care. So dementia is a very severe condition, and it brings a lot of need for care. So it's a huge contributor to the work of health systems. But the main findings is that there are examples, there are models of good care, but they're not used very much. So there is a lack of knowledge, and we need to educate policymakers how they can develop their health systems and how to respond to the dementia epidemic. I think it starts with awareness. It starts with the societal attitude towards dementia. Is it seen as a disease, as a medical condition, and not normal part of aging? That's still an important thing in many countries. And then people need to be diagnosed. They need to be offered diagnosis and treatment after that. We have to look into better care systems. Another important area is prevention and risk reduction, and then finally more funding for research. I think those 5 areas are the main challenges for the next 5 years. We don't have much time. As I said, the numbers are going up. We urgently need solutions, but I think between 5 and 10 years is a realistic time frame for that. Well, I think what ADI has achieved is that we have given people with dementia a voice. So it's not only the professionals and the policymakers or the care providers, but the people themselves. They have a voice through our organizations. We try to involve them in the work of ADI. I think we also made the world aware about the size of the problem, and that it's not only something in the higher income countries, but in all of the world there is dementia, and the majority of people with dementia already live in lower and middle income countries, and they will see the biggest increase in the next decades. And then I think we also achieved to bring the community around dementia together, all the different disciplines, so people with medical backgrounds from neurology, psychiatry, geriatrics, but also people from the healthcare provisions, primary care, and then the caregivers and the people with the disease, and try to unite them and bring them together. The 1066 Dementia Research Group is a network of researchers from all around the world, mainly from lower and middle income countries. It was formed because there was no research and no data in those countries, and they do population-based studies. So they try to find out how many people live with the disease in a country, what are the main risk factors there, how is the health system responding, what kind of services are available. And they put it all together, which makes it possible to give overviews of a larger group of countries and compare those. And they have published a lot of papers about various topics. And they're very much involved with ADI because we are sort of hosting the group, and their work has been very important for the ADI reports over the years, because we have data from all around the world now. Because there's still so little knowledge about it, and it's more, if it's more accessible, it's more likely that people will read the papers and maybe will use it for their own research, refer to it, get stimulated to see if they can use it in their country or if they can replicate research in their country. Yes, World Alzheimer's Month is the month of September. We originally started with World Alzheimer's Day on the 21st of September, but over the years this has been a day that is used in many countries to raise awareness about the disease, to go out into the public and a little bit celebrate also the movement, with a variety of activities on the national but also on the local level. And ADI is just an umbrella, and we provide a team and some materials for it. A few years ago we got a request, can we extend it to a month, because many countries already did activities for a week or 2 weeks or longer. And we decided to test that in 2010, and then in 2011 and 12 we had a full month. And it's an opportunity to raise awareness about this issue. And the things that are happening are, for instance, memory walks, public lectures, plays, movies, films, all kind of things where people come together. Yeah, the theme is the journey of caring. So we're looking at the continuum of care from the moment that the person is diagnosed till the end of life, which is often a long time and a huge burden to the families.